last almost 2 years, we have been having this meeting every Sunday, and mostly we've been talking about all things COVID. Dr. Nidhi Dhawan is with us, and today we are going to be discussing about Omicron and how how we feel, whether or not this is actually a mild disease or whether it does have some long-term implications. So without much delay, I would request Dr. Nidhi to take over the session and enlighten us further.
Thank you so much, Meenakshi. So last week, I became a part of the statistics. Uh, in fact, my whole family did. And that's what happens with Omicron. We don't know who was the index case in our household, but probably uh, one of us was exposed in the hospital to somebody, a professional hazard, I think. So let's start the presentation. We'll do the update as usual. This last week, if you see, Israel has been going vertically up. It did seem to come down in between, and after that, the journey has only been vertical.
Dr. Nidhi, if you are moving on with the slides, we are not able to see it. So we are still on the first title slide.
Can you see it now? Should I stop share and share again?
Yeah, probably. And then if you can just hit on play, that would give us the whole presentation instead of just a snap.
Share screen. Now you can see it?
Yeah, now we are on this slide with COVID-19 cases per million people.
Yeah. So as I said, if you see, Israel is going vertically up, and that's after 4 doses of vaccination. Interestingly, last week, the European Medical Agency has come up with the finding that frequent vaccinations can in fact harm the immune system. So it did seem to go down a bit somewhere around 15th of January, but it has then gone up again. US seems to have hit a short plateau. We have to see whether it is going to start coming down from here, which is the way Omicron generally works. UK definitely is down. If you look at Japan and India, interestingly, they are following a very, very similar trajectory. And, the skeptics would say that India is not testing enough. Indian population is too big for these small numbers. And so all said and done, Japan and India are doing pretty nicely. South Africa hit that peak, but has definitely now come down. And Ethiopia, just for reference, hasn't even picked up. So if we look at what is the share of Omicron in all these countries, UK more than 95%, Japan more than 97%. So with those number of cases, if you saw, Japan and UK are kind of at similar numbers. US has crossed 90%. Israel and India are in their 80s, India in early 80s and Israel in late 80s, which should mean that these countries should both be going up a little more. But the numbers seem to be kind of leveling out in India. That was 10th of January. As of 19th of January, UK nearly 100%, US nearly 100%. India seems to have increased further in this last week. We hit 330,000 on 2 successive days. So this is where it stands. India about 85%. With our sequencing, this could be a little higher now. I feel like mostly what we are seeing is Omicron, and there is a clinical way to say that it is. And as Dr. Meenakshi and I have been saying, whether it is Omicron or not, it is still COVID. And now I can tell you practically, having gone through it, it is COVID. So if we look at the map, we are back to the same situation. The sub-Saharan Africa practically uncolored. Everything else becoming darker and darker. Australia, which had a zero COVID policy, if you see, is the darkest right now. Respiratory pathogens are not so easy to control. Looking at how variants have affected India, so this gray is where we didn't do any typing. And the blue patch is when alpha emerged. The green patch is delta, and you see how delta quickly and comprehensively took over. And then Omicron started end of December and has just been climbing. Now it has crossed 80%, which might be a slight underestimation. We might already be around 90-95%. But very quickly, it has crossed to be the dominant strain. If you look at UK has been doing maximum sequencing. So here, when the original wild type, Wuhan type, here alpha, they had a bad alpha wave, and then delta, little bit of other variants, including beta. But look at how Omicron has completely taken over from delta. US, very colorful map. They have everything. So they had beta, they had epsilon, they had gamma and kappa and iota and mu and Wuhan and others and alpha. Then delta comprehensively replaced everything. Starting around August, delta completely took over. And then, similar to India's picture, starting late December, early January, Omicron has completely taken over. If we look at the reproduction rate, the effective reproduction rate. So if you look at this line is 1, which means that if it is close to this line, the exponential rise of cases will not be seen. Every case is infecting at least 1 case. Every case is infecting at least 2 cases, 3 and 4. So if it is less than 1, then it's on its way out. And you see that UK has fallen less than 1. Israel is approaching 1, US is approaching 1, India is still around 2, Japan is around 2.5. So India and Japan would probably be seeing a little bit of increase in the coming few days, which is what is expected from our estimation also. The UK data, we'll come to that a little later. If you see Israel is a country of just about 10 million people. And you see 64,000 cases. That's a huge number for Israel. And coming to Japan, 40,000, 50,000 cases. Again, for Japan, it's a huge number. We were seeing 100, 400, 200. So this is a big number for them. Largely Omicron, which is encouraging. South Africa, they seem to be going down. They have come down significantly. Doesn't seem to be going up, but South Africa has very clear peaks for every variant. US, we definitely see a blip in the curve, but the numbers are still, the daily numbers are higher than the 7-day average. And we have to wait for this trend to become the norm before we say that it is definitely on the way out. India, so we are still much higher than our 7-day average. It doesn't look like it is coming down. However, the slope seems to have slowed. And everywhere that you see Omicron, you see that the peak is always higher than the Delta peak in all geographies, which is not what has happened in India as yet. And that may be because we are not testing enough. So taking our index cities, as of 21st of January, Delhi, again, whether it is a function of testing or it is a function of actual incidence or it is a function of now we've got to live with it. The 7-day average is close to 15,000, but the new cases have come to 10,000 and the curve seems to have come down. Uttar Pradesh, it's kind of staying around the average of 16,000. With the elections approaching, the festivals and the river dips going on, this doesn't look like it is the real number. Maharashtra close to 50,000, and that's, if you see, it's like Israel, but Israel has a much bigger land area and much smaller population. Kerala, again, around 40,000, but the 7-day average in Kerala was 29,000. So this is on the way up again. If we look at vaccination status, Israel, as I told you, is nearly 90%, 100% vaccinated and has even given 4 doses to most of its population. Japan, close to 80%, UK, close to 80%, US, close to 80%, India, close to 70%, Egypt, Ethiopia, less than 10%, Egypt, less than 40%. and these are in the less colored area of the map. Um, if you look at the active cases now, Omicron is happening much faster than as of now the recoveries are happening. So the numbers are going up in active cases, and the currently infected load is rising to nearly 2 million. The daily positivity rate is beginning to flatten out. We saw this going up to 25% also. Now it is back down to 17%. Looking at recovery rate, we have a recovery rate of about 94%. Vaccination doses are happening every day, and now we are including the younger population also. So total tests conducted is not bad, but uh, maybe not nearly enough. Total cases in the last 24 hours, as I told you, has hit about 3.5 lakhs. And patients recovered is in the last 24 hours is 2.5 lakhs. So, you're adding about a lakh every day despite the recoveries. So till this figure, new cases starts to come down and this figure starts to go up, the active case load will continue to rise. Now, given the fact that nobody has a crystal ball on it, but given the fact that Omicron is highly transmissible, usually recovers within a week, and seemingly gives immunity against even Delta, what really is the future for COVID-19? There could be several scenarios which happen. We have been now with this virus for nearly 2 years. First scenario, a good scenario, is that our body begins to recognize the virus. It's no longer novel. Immune responses are measured timely, and health and homeostasis promoting. Having gone through Omicron, I can tell you that it is not yet quite there. The second thing could be that the population parameters move towards endemicity. There could be seasonal waves or pockets of disease emergence, and they could settle down in the natural course, and we all learn to live with it. The third scenario could be that the vaccines actually become better, and like we eliminated smallpox, and we took a long time doing it, we could eliminate SARS-CoV-2. Looks like wishful thinking, but we have the technology now, and we have the biotechnology now to do it. Newer therapeutics are constantly being added, and significantly in the last week, extravesicular ACE2, nanoparticles and bacterial lysate extracts have been experimented with. These both cause less severe disease. So there is as yet no sterilizing therapeutic that we have. It does appear that there is some cross-neutralizing. It does give added protection. And now this is a January 2022 update of an article which came out in October 21. The interesting thing about um, nanobubbles, ACE2 nanobubbles, is that they are being programmed for intranasal delivery, which means that it could actually act as a enhancer of innate immunity and probably mop up the virus before it infects the nasal mucosa. This ACE2 circulating on nanoparticles, lipid nanoparticles, mops up the virus because it acts like a decoy. But there is no cell that this ACE2 is attached to. So it attaches to the virus and doesn't allow it to attach to a normal cell. This was interesting that this is a bacterial lysate, a combination of molecules extracted from cell wall of bacteria under the brand name Bronchovaxum. I was surprised because some time ago, nearly 5 years ago, Bronchovaxum even I have used as prevention in recurrent respiratory diseases, and then we just stopped using it. But Bronchovaxum has been used in prevention of upper respiratory infections in children and in adults. We used to give it as a capsule form, 1 capsule a day for 1 month. This seems to have some preventive action in COVID-19 also. So how it works is it probably decreases the expression of ACE2 receptors. Now, with Omicron, certain things become important to note. What is a breakthrough infection? What is a reinfection? Can you be reinfected? When do you come out? So all these things become important to note in Omicron context. When a fully vaccinated individual gets COVID, this individual is capable of transmitting it further, and this is known as a breakthrough infection. As the number of people who are vaccinated, double vaccinated, triple and quadruple vaccinated increases, it stands to reason that new infections are going to happen in the vaccinated people. And anti-vaxxers are, or people with vaccine skepticism are waxing loud that, it's the vaccinated people who are spreading the disease. But for sure, vaccination provides protection against severe disease. And till we come up with something better, vaccinating our population in significant numbers is likely the only scenario where we can move towards a new normal. A reinfection is when a person who got infected, recovered, and then got reinfected with COVID. Initially, it used to be that you have to have a time gap of 3 months between 2 infections, but so that you're not looking at reactivation. But now reinfection can be anything from a week to 15 days, because that's the incubation period for Omicron. Now, you have symptoms and you test positive. So now what? We have been saying that you will treat the symptoms and follow the signs. At the same time, we have been reading from various reports that Omicron infections are largely asymptomatic and are considered mild. that resolution within a week is a rule rather than an exception. But I can tell you from my personal experience that the throat pain was definitely not what I would call mild. The first 2 days after testing positive, all I was doing was sleeping and sipping warm water. It By the third day, definite recovery had started, and today I don't have anything except a little bit of scratchiness in the throat and an occasional dhaska of khansi. High risk individuals do need extra care and diligence. We would continue to follow CBC and CRP. Um, the uh, the disease as it stands today does resolve within a week, but viral shedding can continue for even up to 3 months. And we don't know whether this is infective viral shedding or it is just viral fragments. So at 5 days, what CDC has said that you can come out with a mask. At 5 days, nearly 30% of individuals are still shedding the virus. At 10 days, 10% is still shedding the virus. And at 90 days, also a few people could be shedding the virus. The time to come out of isolation is when you are asymptomatic without medication for 3 days or 7 days from first symptom, whichever is later. Now, a lot of people have this question, uh, when can we go back to normal life? If we were running marathons, if we were doing weightlifting, if we were, so when do we get back to normal? With Omicron, the temptation to get back to normal is very high because resolution is very quick. But the past experience shows that the milder the disease, um, more the chances for long COVID and higher inflammation. I would say that if the 10th day CRP is normal, then a graded increase in activity is quite okay. But you have to pace it, you have to take it slow and gradually increase the effort to your previous levels. That increase can be over a period of 2 weeks to 2 months, depending on how your pacing is tolerated. In the UK, we find that the studies on long COVID are showing even up to 80% people, not with Omicron, because we haven't got the time experience, the temporal experience for long COVID, but for Delta and for previous strains, up to 85% of people can have some or the other symptoms 3 months to 6 months after initial illness. These could be persistence or emergence of new symptoms. So the age groups which are most affected are 25 to 65. And if you see, this is the most productive age group in the population, the working population. Fatigue is the most common sign. Slight niggling cough, headache, myalgia. Now, loss of taste, loss of smell was found with Omicron, with Delta, not seen with Omicron. So, as far as outcomes are concerned, three things could happen. Either we will find that Omicron completely resolves, or that there could be some long COVID-like syndromes emerging, or there could be a combination. Because, when we say mild disease, interestingly, Dr. Swaminathan yesterday in the Medical Association's meet said that WHO is now saying non-severe, severe, and critical. So we are not even talking about a mild disease because we understand that COVID is COVID. So long haul COVID can affect practically any organ in the body. The reason why it does that is because ACE2 is present everywhere. And it long haul disease seems to be a function of endothelial damage, of inappropriate monocyte activation, and of persisting immune activated platelets. The lasting impact of COVID has been seen in practically every system. And this is a Washington State University graphic which tells you about skin disorders, about GI disorders, about anxiety, depression, sleep problems, mental health disorders, musculoskeletal. So there is not a single system which seems to have been spared. And we all know that CKD becomes much worse with serious COVID. Nearly 58% of people show fatigue, nearly 45% headache, 12% digestive problems, 16% memory and cognitive dysfunction. So you can have an acute illness which not like, but similar to common cold becomes better within a week. You could have prolonged symptoms with or without viral fragment shedding, or you could have long COVID syndrome. The initial acute illness seems to be dictated by the viral replicative phase. The prolonged symptoms seem to have something to do with the persisting inflammation and probably thrombogenesis. And the long COVID seems to be marked by TNF alpha, nuclear factor kappa beta, IL-6, and other chemical mediators. The latest molecule to join the army is NRF2, which it seems like will affect all pathways, including nuclear factor kappa beta, including the JNK pathway. This is for handling oxidative stress and metabolic inflammation in the body. And the NRF2 activation causes its effects on almost all cell types. It suppresses Th1 as well as Th17 response. It suppresses macrophages and dendritic cells. It decreases free oxygen radicals, and it activates Th2 and T regulator cells. So the activation of NRF2 is anti-inflammatory in nature, and COVID seems to deactivate NRF2. Melatonin has a role in activating NRF. Melatonin has been found to have its anti-inflammatory action through the NRF axis, the antioxidant function through the NRF axis, immune modulation, cardioprotection, neuroprotection, circadian rhythm, sleep dysfunction. So a lot of things which are happening in prolonged COVID can be handled with melatonin. Melatonin is a natural uh, neurochemical, so it's not even habit forming. The other um, agents which have been found to have good effect in prolonged symptoms are atrovastin, apixaban, cyproheptadine, ivermectin, artemisinin, loratadine, which works on the monocytes more than cetirizine, and GABA and pre-GABA compounds. So we should be moving towards handling whatever the curveball this virus throws at us. फीवर है तो मेफेनेमिक एसिड दो, मेफेनेमिक एसिड से ठीक नहीं हो रहा है तो ऐड पैरासिटामोल एंड निमुलिड, warm fluids for the throat, cough suppressants for dry cough, expectorants for productive cough, add cyproheptadine for immune activation of platelets if you find the platelet counts going up, and add loratadine for monocytes if you find monocytes going up in the CBC. So in my CBC, the monocytes have gone up a little bit. My monocytes are at the maximum of 10, whereas my CRP is not detectable. And I'm also surprised because मैंने alternate day readings कराई हैं और पूरी family में, मतलब we all 4 of us. So Sanjay's CBC did rise up, but all others, all 3 of us.
CBC rose means all the cell lines rose? Or do you mean CRP? You said CBC rose.
CRP संजय का बढ़ा हुआ था.
Okay,
CBC
you said
सबका
CBC.
कराया है. CBC सबका कराया है. उसमें largely lymphocytic response है, which is what you expect for viruses.
Yeah.
And TLC is maintained, which is what you expect in a good robust immune response. But मेरे monocytes बढ़ गए, जो बाकियों के नहीं बढ़े हैं. So I'm taking loratadine as of now. I don't have any symptoms except this little bit of scratchiness. But during the first 2-3 days, I was feeling a little lightheaded. And even though the blood pressure was maintained, I had no other problem.
Did you monitor sugar levels? I have seen a couple of patients who have reported hypoglycemia, which is very strange to me because we had seen so much hyperglycemia in Delta. And in fact, even in my own family, I had noted, and I was just talking about it this morning. There has been one of my patients. He was a diabetic. He had to be admitted, so there was no extra dose of insulin or anything that had been taken, and he had to be admitted for an outpatient. Not admitted per se, but yeah, he had to be taken to the emergency to give him a dextrose. For hypoglycemia. He was quite hypoglycemic, and in fact, he was saying that we started monitoring everyone in the house, and everyone had like somewhat low levels of sugar. So
I didn't monitor that, but
yeah.
could be, yeah.
Yeah. So this is, and it just got me thinking. I have seen this in a couple of patients. I asked them to monitor sugars, and the sugar levels were low, which is very strange because I can't think of a mechanism of how the sugar levels would, go. Because any inflammation would cause hyperglycemia. I cannot imagine
how it goes down.
Yeah, how it goes down.
Yeah.
But yes, so that's I mean, if you ever do feel lightheaded, then you can get the sugar levels checked and see how
Yeah. Yeah.
that's happening. So I think that was Dr. Nidhi's presentation. Now we are opening the floor for questions. There is a question here by a Zoom user. They've not mentioned their name, and they're asking about monoclonal antibody, sotrovimab, and the dose and mechanism of action.
So, trovimab, like any other monoclonal antibody, will work on the receptor binding domain. It is used as an injectable, and it is, I think, given as a single dose, but I'm not so certain. Um, so it would require admission to a hospital, and it's reserved for people with uh, higher risk of progressing into the disease. I don't think we have needed to do that in Omicron. I mean, now my experience has been, including the family, for nearly 100 cases in the last 10-15 days, and that's a large number. So I don't think I have had to use any of these, um, fancy is a bad word, fancy treatments. So
Well, are there any high risk patients in small cohort that you have where you
uh,
would need
so my
so-called
father
fancy
is
treatment?
my father is 81.
Okay, okay.
uh,
So I
my
remember your father was also infected in Delta.
Yeah, and he got infected again.
Okay, yeah. So in reinfections, I think that it's high time that we start releasing data about not we, but
Yeah,
people
I
who
mean, we
do report, they start releasing data because earlier it was just 5%. I really think it's much larger
it's
number
much
now,
larger. Yes,
much
much
larger
larger.
number.
Yeah, and that may be one of the reasons why Omicron is not so severe. I mean,
Yeah.
it could be.
So that's what I was saying, that that we have vaccination immunity, sorry, induced immunity as well as natural immunity, right? So I think that is one of the reasons. This is what I had mentioned even in the WhatsApp group that we had, that this could be one of the reasons why we are seeing, and that is why last week I had asked if anyone has any experience with unvaccinated and absolutely naive, the so-called co-virgins. If anyone has any experience with them with illnesses now, but I think ऐसे कोई मिल ही नहीं रहे
So,
हैं patient.
my mother is unvaccinated,
Okay,
and she also got it.
and she's
My
And
fine.
then
granddaughter, 16 years, 17 years, she is unvaccinated and she got it.
and
But
it is,
that's again a very low risk population, so that's
but
something.
my mother is not a low risk person,
Yeah, you're not. Yeah,
and she's doing pretty well. So
okay.
that's what I'm saying. We don't know, what is happening, and
So then the fact,
it is possible that my mother may have been exposed during Delta, and
yes,
has some natural immunity. I
yes,
don't know.
yes. So the fact that it's also not infecting the lungs is also contributing greatly to the fact that
True.
people are not getting serious, because people do just get serious in the inflammatory phase of the disease process, and that's something that's a big relief in this way. In this way, I would say.
Yes, yes.
Ritu ko to lungs involve ho gaye the, Meenakshi.
Hanji, so most likely that was
That was
Delta. We had
Delta.
seen lots of lymphocytopenia as well, high CRP with counts normal. That was most likely Delta. In fact, I'm seeing a lot of people with कितना था उनका score? 8/25, correct?
8/25.
बहुत सारे cases I am seeing जिसमें 4/25 आ रहा है, 4/25, 5/25, but इससे ज़्यादा I'm not seeing. So again, very difficult picture, and the fact that we are still dealing with Delta, it's a little worrying, because um, we are all taking it so lightly thinking that it's just Omicron, and
But it started
It's not.
mildly. It started with mild symptoms like
which
low-grade fever, and there was
that this
no
is what
other
exactly
problem.
I had said
Second week
a
में
few
जाके
days a few days ago, a few weeks ago, when Dr. Nidhi was explaining the difference between the two variants, we had discussed at that time that the जो Omicron के जो Delta के late phase में आते हैं, वो Omicron के early symptoms हो सकते हैं.
And
ये कब तक
also
देना उसको cortisone और anticoagulant कब तक देना उसको?
21 दिन तो
3
हम देते हैं.
3 weeks, yeah.
Anticoagulant
But-
also?
Yes. Her DMA was high.
But I think as both of us have been saying, Meenakshi, that whatever the name of the variant, it is still
Absolutely.
COVID.
Absolutely.
And you have to treat it as COVID, and you have to monitor it as COVID.
Absolutely.
So,
I completely agree with you, and this is the main crux, and I really hope that this gets across to people, because the media is just going to come up with new variants every day and try to create a hype about them. So there were, like, I think in the last 15 days we've heard of 2 more variants that they've tried to create a hype about, but it is not actually that serious, so it didn't really pick up. Omicron, as soon as we had heard about it, I think 24th December, we had started hearing about it, and then it just started jumping in most of the countries. So
right.
but Omicron had that very special characteristic in which this S gene dropout was there, so it was much easier to detect it probably in wherever the genome sequencing was being done.
Yeah.
So
yeah. Also, now in the last 3 days, the significant thing that has happened is UK has dropped all COVID
Yes.
mandates. So if you have to travel to UK, you don't have to take an RT-PCR. You don't have to have a. So it
forget
at a
traveling,
point
even
it
within.
looks. Yeah, but हमारी भी, see, local travel तो हमारी भी अब people are not asking for anything except vaccine. I mean,
I'm saying forget traveling. उन्होंने तो mask पहनने से भी मना कर दिया. They're saying within here you don't have to follow anything. Offices are not allowed to ask for anything. I think I may be mistaken, but I think even like they've even gone as far as to say that vaccination is not mandatory for anything. I might be mistaken here, but
no, they have removed all mandates.
Yeah.
So now it is all voluntary.
Yeah.
Now at a level, it looks like you are doing something which is very brazen and very. But अगर आपका 95% Omicron है, आपके 80%, 90% population double triple vaccinated है, और now the epidemiologic assumption would be that now the population can deal with it.
Yeah.
So at another level, even though it looks brazen, but at another level, it is like you're moving towards a new normal, and next in line would probably be US, and then the other countries are going to follow. So maybe endemicity is not as far as it looked just a month ago, unless a new variant emerges and unless it does something bigger, mightier and naughtier.
तो पहले हम कहते थे कि host factors as well as viral factors. Host factors तो अब 100% हम दे ही रहे हैं. We are not following the COVID protocols, and I mean, well, if you talk about UK, so host factors though are all there. Viral factors now, it's just up to the virus now whether तबाही मचानी है या नहीं मचानी.
True.
Dr. Kapoor has asked if he should get blood sugar test along with CBC and CRP. So if a patient is complaining of hypoglycemic symptoms, then that is something that you would probably be able to recognize. Maybe a layman would not know what the hypoglycemic symptoms are. Then you might just be alert and try to order it. So just जो कोई कह रहे हैं मेरा बहुत ज़्यादा जी में चल रहा है या भूख ज़्यादा लग रही है, चक्कर आ रहे हैं, ठंडे पसीने आ रहे हैं, then I am asking them to get their blood sugar levels checked.
So
but I think as a routine,
this was there, Meenakshi, that people generally say loss of appetite. I was having increased appetite.
Yeah.
So this was also
it could
there.
have been.
Yeah,
it could have been hypoglycemia.
Yeah.
Madam, I have also seen the same patient yesterday. That he has semi-consciousness and the symptoms of the cough, cold, and fever. I referred to the hospital. In the hospital, it was found to be COVID positive, and the blood sugar was only 38. And they started.
Oh.
Yes.
So this is so I
that's-
think this
yeah.
confirms my hypothesis that
Yes.
this particular variant is causing
We
hypoglycemia.
can miss hypoglycemia
Yeah.
clinically.
So yes, so I think that we can all just be a little alert about these things,
Yeah.
especially for patient complaints, and we can, So I always like telling the patients, जो diabetic patients होते हैं, when we put them on insulin, I tell them to keep dates by their bedside. अगर इस तरह के symptoms आ रहे हैं, check करो, अगर है तो करो, because the glycemic index is very high and it shoots up your blood sugar levels very fast. So if
And the patient had the symptoms of the severe stroke.
Yes. So no, of course, that patient had to be taken to the emergency. But so this could be another set of instructions that we need to give the patients. I don't think there are any more questions. And if there's anyone else who would like to discuss any new finding or any set of symptoms, new set of symptoms that we are seeing, then this would be the time to do that. Otherwise, probably you can call it a day and a week.
Dr. Meenakshi, I have a little question.
Yes, Dr. Arora.
Yes, sir.
हाँ, ये एक hypothesis ये भी आ रहा है कि Omicron infection will work as a vaccine. So UK has removed all the bans.
Yes. Definitely, I think natural immunity is. I think ये तो I think study एक अभी थी भी. I cannot remember exactly who had written it and where it was from, but there was this robust study that had said that a natural infection along with vaccine, this provided the best immunity that you can have. So double vaccination and then immunity, and then उसके बाद में booster की जरूरत भी है नहीं है, that's debatable. But yes, I think I personally, so I was infected in May of 2020. I was living right now in a house of at least where there were at least 10 to 15 patients, and I had no symptoms whatsoever, except for maybe little nausea, no fever, nothing. In fact, even in September of 2020, when my mother was sick, I was going inside the ICU and I was going in and out, but not even one episode of fever, no symptoms, nothing. So that was. I don't know whether which variant would probably the original strain in May of 2020, and since then, fingers crossed. But I've been like constantly in exposure of a lot of people, and I've been traveling quite a bit, and still no symptoms. So natural, I honestly believe that natural, and so मैंने sir को बोला था कि sir, every time I'm coming in contact with a patient, my antibody levels, so my strength antibody levels check कराने का, my antibody levels are increasing. I'm testing COVID negative every time, and I'm just getting very mild symptoms, maybe one single episode of diarrhea or maybe just a little bit of nausea, nothing else. Sir used to say, तो तुम खुश रहो ना, तुम्हें तो booster मिल रहा है बार-बार. उस समय vaccines hadn't even come out, I think. He's like, so this is what probably happens. Natural immunity, so I'm an example. I was literally living in a house where there were even my own children, they were infected, they were positive, they had high fever, but I didn't have any symptoms at that time. So it's been like almost 2 years now since I had the infection.
There is another interesting thing which has happened in the last 2 days.
Yeah.
That interesting thing is that a study has come out from Brazil, which is of nearly 200,000 patients or 300,000 patients, and ivermectin. Now this is and it is comprehensively proving that ivermectin works. So gradually, I think these things will start making more sense. And the thing to do is that we have to keep our head on our shoulders. We have to keep using logic rather than be polarized by any political view.
Right.
So
Dr. Meenakshi, this Omicron, I'm seeing a lot of pediatric patients coming with just vomiting and fever. And
Yes, yes.
Yes.
Upper GI
And
symptoms more than lower GI symptoms in this wave. I'm seeing, yes, even so not of course I'm not seeing the pediatric age group, but then I'm seeing a lot of patients who are complaining of vomiting and nausea more than uh, diarrhea, which we had seen in the previous waves. Especially in the first wave, we had seen a lot of patients with GI. Second wave, it was more of pneumonia. It was diarrhea, then followed by pneumonia. So the pneumonia ki jo symptoms and complaints they took over because it had more priority that we had to give. But yes, in this particular variant, I'm seeing a lot of upper GI symptoms.
Madam, what is the action of the bronchovaccum?
bronchovaccum decreases the expression of ACE2 receptors. It's a bacterial lysate, so it also promotes formation of antibodies, but to bacteria. So that would not be the action that it would have in COVID. Lekin bronchovaccum ki studies were for recurrent bacterial infections in young children. And in that, one capsule a day is really very effective. I think lupin ka aata tha bronchovaccum, I'm not sure. Yeah, maybe Dr. Reddy's ka. I'm not sure kis company ka aa raha tha.
And it should be given for 1 month.
What does it contain? Bronchovaccum. What does it contain?
Bacterial cell wall lysate.
Yes, nice.
Dr. Nidhi, you are using new anti-allergic Bilastine? What is your
Sir, Bilastine is like
Antihistaminic.
Yeah, it is like cetirizine only. I don't see any major advantage of using Bilastine, especially अगर हम monocytes बढ़ते हुए देख रहे हैं तो लोराटिडीन का ज्यादा अच्छा इफेक्ट है.
Okay. इसमें यही एडवांटेज है कि एक तो सेडेशन नहीं होता और एक ड्राइनेस नहीं होती.
सर कोई भी ऐसा एंटी एलर्जिक नहीं है जिससे सेडेशन नहीं होता. मतलब
मुझे तो Allegra से भी नींद आती है.
So I was going to say that my colleague Nishi, she gets sedated with Allegra, and so loratadine, Claritin, is one which is reserved for Air Force pilots.
Least sedative.
It's the least sedative.
Loratadine.
And loratadine.
Okay.
And it is also
Loratadine भी आता है, that is better than
desloratadine वो कहते हैं कि वो उससे और भी कम होती है सेडेशन, लेकिन जब लोराटिडीन से ही नहीं हो रही तो टेस्ट को क्या करना है.
ठीक है.
One thing more I have noticed,
इधर पे जंगला पड़ा है, ये उधर मेरे लाल फूल है ना उनके साथ डालते.
Sir,
one thing more I have noticed, even at the high CRP, the HRCT is absolutely normal.
Yes.
No findings at all.
Yes.
lungs को infect ही नहीं कर रहा है.
Cases बिल्कुल ठीक निकला एकदम.
बिल्कुल.
HRCT तो करा ही नहीं रही मैं. I'm not been asking them to get it done. Patients आते हैं कहते हैं.
You become scary. कहीं कुछ ऐसा हो ना जाए.
नहीं तो फिर अगर लंग कॉफ के सिम्टम्स अगर डेल्टा में पेशेंट्स देखे हैं, if anyone who has seen the patients in delta regularly, then you know that वो सीरियस पेशेंट की आवाज कैसी होती है, उनका पैनिक मोड क्या होता है. एंड वो HRCT में 6/25 आने के पहले ही उसकी हालत बहुत खराब होती है. द पेशेंट इज रियली नॉट डूइंग वेल. So as soon as you see that kind of a patient, you know that you need an HRCT. अभी तो मैंने तो I think इतने दिनों में I think 2 जन को बोला होगा, and that too I got scores like 4/25. 2 patients में आया, and of course Dr. Kiran's daughter is there who had 8/25. So other than that,
इनिशियल जो डर लगता है ना स्टार्टिंग में जो पहले केस आते हैं
हाँ जी वो तो है, yes, because we've seen those delta वाले patients ना, तो एक बार लगता है, but of course
but you will also find that the patients of delta start showing confusion and disorientation. They start showing that because of hypoxia. So वो chest वाली चीजें आ नहीं रही है इसमें.
हाँ, yes.
नहीं आ रही.
SpO2 is mostly 97, 98.
हाँ.
Even I have seen D-dimer up to say 2000 so, but still there are no symptom at all. Patient is absolutely.
Yes, D-dimers, even I am seeing a lot of patients जिनमें थोड़ा CRP बढ़ता है on, so I don't get D-dimer done. So I'm first running a free OPD, so I don't get D-dimer done very frequently. I just get it done maybe on the 5th or 6th day. That's when I'm expecting maybe something to go wrong. So in the patients who can afford, if I see that the CRP is high, then I order it. Otherwise, we don't. And I am seeing quite a few patients. A good percentage of the patients are having a high D-dimer.
And another case I like to share, old lady around 68-year-old, the CRP around 140 or so for 2 consecutive days. Severe throat pain. And by adding that amoxicillin, it improved. But CRP was high. मतलब उसका एक बार तो डर लगता है कि 67 years की है, diabetes है, blood pressure है. But clinically she has improved a lot. So I have to going to repeat it again today. Let us see.
Hopefully all will be well. Yes.
Madam, in the long haul COVID, melatonin should be how long continued?
What should we continue?
Melatonin.
Melatonin.
Yes.
See, ivermectin on a weekly basis, melatonin on a daily basis.
So how long?
As long as, that's what I was coming to.
Many patients have the complaint of this sleepiness, insomnia. That is why I'm asking.
This is what I'm saying, that these two, ivermectin on a weekly basis and melatonin on a daily basis, as long as needed. Because inka koi dono ka hi, there is no habit forming or addiction potential. There is no dependence. So you can use them as long as needed. There are some people who in any case take melatonin for breaking their jet lag.
Yes.
So isme koi, there is
this
no
is
harm
what
at all.
I when I give it to my patients, I tell them this is just a natural hormone that regulates your sleep cycle anyway. So it's just supplementation of that. So then I guess they're a little more receptive to it. Chalo, I think on that note, we can call it a day, or maybe a week, and we'll see you again.
Hopefully, we'll not have to do something more COVID now.
I think now with Dr. Nidhi's illness, we can just really call it, कि अब हो गया, we are done.
And now the patient has no panic about the COVID.
Absolutely. But we are assuming that long COVID might be a real problem with so many people being infected.
Let us hope that it will
and
not
reinfected.
Yes.
We are not.
किसका मेरा?
हाँ जी.
मेरा detectable ही नहीं है.
अच्छा.
मेरा detectable ही नहीं है.
And the same with your mother and your father?
Yeah.
Okay, great. Sounds good. Lab change करवाए.
आता तो है भैया तो आती है उसमें.
नहीं उन्होंने लिखा हुआ है less than 2. They can't see it. So
it means it's less than 2.
So that's great news. So on that happy note, we like to end this show today. A big thank you to all of you for joining in and keeping the show alive. And also a big thank you to all the Facebook and YouTube viewers for motivating us to do this every week and keep learning about all things COVID. We'll see you again next
I have something very important to tell you today, and I'm so glad I was invited to this particular TED meeting. I really am, because it's all about dreams, and that's what it's all about, and no kidding.